Hi, I'm Aimee Foord. I'm the director of the Bleeding and Clotting Disorder Clinic at Cure for the Kids Foundation. What is a bleeding and clotting disorder? So, bleeding and clotting disorders can be a multitude of things, and trying to figure out what it is one of the reasons why I love my job. So when you bleed, get a cut or a bruise, or you have a period or a nosebleed, your platelets are the first thing that go there to help you stop bleeding. But our body's so smart, we can't just rely on our platelets. So then we have things called coagulation factors that go on top of the platelets to help form a strong clot. In addition, we have something called von Willebrand factor. That's the mesh that holds the platelets to the area of injury to help stop bleeding. Now, any of these different parts can go awry. We have genes that create these clotting proteins that could be mutated in a patient. We have family history that predisposes us to some bleeding and clotting disorders. But our body also makes clots. But we don't want to clot too much. So even if we bleed and our body does produce that clot, our body tries to break up that clot. And if it breaks it up too fast, we could bleed. If we have genes that predispose us to clotting more, then we may clot more. So there's lots of different pieces to this puzzle. And each individual could have one abnormality or a couple that even each other out. And like I said, this is the puzzle that makes me love my job, to try to figure out how to help you. Bleeding and clotting are opposite ends of the spectrum, but like I said before, I have lots of patients that carry a gene that increases their risk of clotting, but also they're a little low in a von Willebrand factor. And so the question is, how do these patients manifest? Do they clot or do they bleed? And what happens in one patient might not happen in the next. And so you really have to keep an open mind, check everything, and treat each individual patient per their symptoms, not necessarily a number or a diagnosis. Typically, figuring out what kind of bleeding disorder or what kind of clotting disorder a patient has takes a couple visits and a couple lab draws, because the workup is extensive. And so we start by sending the most common abnormalities. Von Willebrand's disease is the most common bleeding disorder. It occurs in about 1 out of every 100 people. And it's more common to be symptomatic as a female because females have periods. Males can have problems as well, such as nosebleeds or bleeding after surgeries, such as after a tonsillectomy. Von Willebrand's is a genetic disorder, meaning it runs in families. And the way it's inherited is something called autosomal dominant, meaning that it will show up in every single line of your family. One of the more common platelet disorders is called ITP for short, and it stands for idiopathic, meaning we don't know what caused it, thrombocytopenic, long word for low platelets, and purpura. Purpura is a rash that shows up on your skin like big bruises. ITP can happen at any age, but it's most common in toddlers. And the way toddlers present is with a rash that looks like little tiny red dots all over your body, as well as easy bruising. And in ITP, the definition is all your other labs are normal except for your platelets, and your platelets can be less than 20 in ITP. A normal platelet count is between 150 and 450, and we're talking thousand. So 150 to 450,000 is normal, whereas in ITP, you're less than 20,000. Other factors that can be low are factor 8 and factor 9. And when factor 8 is low, that's called hemophilia A. And factor 9, when that's low, that's called hemophilia B. So carriers can have mild hemophilia, but some carriers don't have any symptoms. So if you have a blood clot, the question is, why did you develop it? There's lots of different risk factors that make you more at risk for clots. And some of them we can modify, but some of them we have no control over. So our genetics are our genetics. We can't change that. But in order to reduce the risk of clotting, especially if you know there's a family history of clotting, is to make sure you always stay hydrated, especially on long trips, plane rides, car rides, train rides. You want to make sure you're getting up every hour to walk around. And when you're stuck in your seat, because you were unlucky and got the window seat or the middle seat, you want to move your heels around and do those exercises that are on those pamphlets. In addition, once you're old and of age, you shouldn't drink alcohol on airplanes because you want to make sure you're getting up and moving around, and alcohol can dehydrate you. So you want to make sure you're hydrated. Other things are no smoking, no tobacco, because that increases your risk of clotting. And if there's a family history of clotting, you want to talk to your OB-GYN or your family practice doctor before you start any birth control. Birth control can help a lot of things, prevent pregnancies, treat heavy periods, but it also can increase your risk of blood clots. So if you have a family history, make sure you talk to your doctor before starting any new medications.